Pertussis is also known as whooping cough or the 100-day cough. It is highly contagious and can be deadly. It is caused by the bacterium Bordetella pertussis. It is transmitted mainly by airborne droplets. After a person coughs a lot, they have to take deep breaths which make a whooping sound. It is an uncontrollable violent coughing that makes it hard to breathe. And the best way to prevent this is to get vaccinated. Worldwide, there is about 24.1 million cases. There are 160,700 deaths annually. In 2012, the CDC reported 48,277 cases in the U.S. In 2010, the CDC saw an increase in reported cases with 7 to 10-year-olds, and in the following years, an increase in cases among teens. Unvaccinated young infants are at the highest risk, and HIV-positive infants. Older children, adolescents, and adults can develop this in a milder form if not fully immunized. Exposure is more frequent in developing countries. Pertussis first broke out in the Middle Ages. In 1914, the whole-cell pertussis vaccine was invented. In the 1940s, it was combined with tetanus and diphtheria toxoids to become DTP. It has been about 80% effective in preventing serious disease and death. In 1990, the acellular vaccine was introduced to the US and replaced the whole cell vaccine. Now both vaccines are used, and there are booster doses for specific age groups.
One vaccine given to protect against pertussis is DTaP. This vaccine is usually given to children in 5 doses, starting at 2 months and ending at 4 to 6 years. Once a child receives this vaccine, they should be protected throughout childhood, and this vaccine can safely be given with other vaccines. Another pertussis vaccine is Tdap. This vaccine is usually given for adolescents and adults to protect against tetanus, diphtheria, and pertussis. This vaccine is usually given between ages of 11 and 12, and it should be given to any woman that is pregnant during every pregnancy. This vaccine is also safe to give with other vaccines. Who should not receive this vaccine? The pertussis vaccine is contraindicated in people who have seizure or nervous system problems, who have ever had Guillain-Barré syndrome, who are not feeling well the day of the shot, or who ever have had pain or swelling after receiving a diphtheria, tetanus, or pertussis vaccine. If a patient experiences any of these issues, talk to a provider about other vaccine options.
Side effects of the pertussis vaccine are mild and typically resolve within a few days. For adults, these side effects include redness, swelling, pain, and tenderness near the injection site, or body aches, fatigue, and fever. There are low risk of reaction for those that require multiple doses in a short duration. However, the most common reaction is pain. For infants, the side effects include fever, redness, swelling, soreness, or tenderness near the injection site, which occurs in 1 out of 4 infants. For children, they can become fussy, which happens in 1 out of 3. They can become tired or develop a poor appetite after the injection, which occurs in 1 out of 10 children, or they can develop vomiting, which occurs in 1 out of 50 children. You cannot get whooping cough from the vaccine because there is no live bacteria in the pertussis vaccine. Pregnant women can breastfeed and get a flu shot while also getting the pertussis vaccine. The pertussis vaccine is recommended for pregnant women during their 3rd trimester because it prevents 3 and 4 cases of whooping cough in babies younger than 2 months when they are too vulnerable to get the actual pertussis vaccine. If the mom did get the vaccine and the infant still becomes sick, the infection was much less serious. It protected 9 in 10 babies from infections that required hospitalization. The babies were less likely to need care in intensive care units, and their hospital stays were much shorter than the moms who did not get the vaccine. Other ways to prevent the whooping cough other than getting the vaccine include infection control measures, such as washing your hands often for at least 20 seconds with antimicrobial soap. If there is no soap available, use an alcohol-based hand scrub. Cough etiquette also improves the likelihood of not getting whooping cough. This includes covering your mouth when you cough or sneeze, either with a tissue into the crook of your elbow or your shirt sleeve. Also wash your hands after coughing and or sneezing. Regularly clean and disinfect your household and any baby items the baby constantly comes into contact with. Also, wash your hands before handling any newborn babies.